be talking about lead poisoning in Thiaroye-sur-Mer, Dakar, Senegal. The purpose of this presentation is to explore and document the health effects of mass lead poisoning in Thiaroye-sur-Mer, Senegal, resulting from informal recycling of used lead acid batteries, or ULEBs. So in 2008, a Dakar neighborhood of Thiaroye-sur-Mer, medical professionals became aware of the sudden death of 18 children. At first unknown in reason, the university hospital believed that the children all died from acute lead poisoning. At that time, the main economic activity in the town was the informal recycling of used lead acid car batteries, which involved the melting of car batteries to reclaim scrap lead inside. In this presentation, I'll start out with a background on these lead acid batteries. I'll then discuss the overview of the crisis in Thiaroye-sur-Mer, including soil level lead concentrations and blood lead levels. I'll discuss lead exposure and different health effects. And lastly, I'll give a summary of the crisis, discuss its legacy, and discuss lessons learned. So, lead acid batteries are the most widely and commonly used rechargeable batteries in the automotive and industrial sectors. In the life cycle of lead acid batteries, lead is extracted from the environment, batteries are manufactured and distributed and bring energy to communities, and ideally, before moving to the trash, they can be recycled back into the manufacturing step of this life cycle. Ideally, this process would be regulated. So old lead acid batteries would be broken apart, lead would be separated and melted down again, plastic would be made into new battery cases, and the old battery acid would be processed as well in a safe manner. However, when this process is unregulated, smelting operations are conducted in the open air in densely populated areas with lack of pollution controls, and lead particles and fumes are emitted into the air and deposited into soil and water bodies. So in Thiaroye-sur-Mer, because of years of informal battery recycling, soil lead concentrations reached up to 302,000 mg per kg outdoors and 14,000 mg per kg indoors. As we can see on this chart, both the indoor and outdoor levels in Thiaroye-sur-Mer well outstripped the WHO limit of about 400. Lead dust settled in homes and public areas and poses ongoing risks. In addition, when the community themselves were tested for lead exposure, all 81 individuals in a study that was done showed lead poisoning. Children's blood lead levels ranged from 39 to 613 Ug per dl, while the WHO reference level was only 5. 17 children exhibited severe neurological symptoms and 18 died. As we can see here from these box plots, these show in the study different blood lead levels in different groups. For instance, siblings of children who died, their mothers, other children, other adults, and total children and total adults. As we can see from every single distribution, all of the groups had blood lead levels much higher than the WHO child or WHO adult limit, here denoted by the dotted lines. So lead exposure does have significant health effects. This table shows blood lead levels and their associated health effects in children. Below 5, we see decreased IQ, attention-related behaviors. We're even seeing health effects at this small level. But when we get all the way up to over 45 or 70 Ug per dl, we see severe neurological effects, encephalopathy, seizures, and coma. As noted in Thiaroye-sur-Mer, most of the children in this area had blood lead levels above 70. Lead exposure can have health effects, but it can also be deadly. In Thiaroye-sur-Mer, there were 950 individuals that were seen to be exposed in a study that was done, and 18 children died. That's about a mortality rate of 12%. A study was done which mapped the neighborhood that was most exposed in Thiaroye-sur-Mer and illustrated the locations of 18 deceased children and their blood lead levels. As we can see, denoted by the blue dots on this map, we can see that there were 18 deceased children And this did map directly onto the highest group of blood lead levels, being 70 to 614 UG per DL. So when we think of the legacy of this crisis, since 2008, we've seen a shutdown of battery smelting operations in the area, a public awareness campaign, soil remediation and cleanup, as well as medical care to those affected. Remediation has been a success. Soil levels are now below 400 ppm, and average blood lead levels have decreased. Between the ages of 1 to 5, it's now down to 53 UG per DL. That is still much above the WHO level. However, other countries in West Africa are leading the way. In Nigeria, they currently house one of the cleanest lead recycling facilities in all of Africa. As we can see here, pictured in this photo of their operations. So for takeaways, lead intoxication is a preventable environmental illness, and it's preventable through a couple mechanisms: national regulations, public education, and promotion of environmentally sound ULAB recycling techniques. This is vastly important to avoid future crises like we saw in 2008. Here are my references, and thank you so much.